Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les personnes suivantes prendront la parole de la séance d'information de cet après-midi. Le Dr. Jennifer Russell, médecin hygiéniste en chef. Le Premier ministre du Nouveau-Brunswick, l'Honorable Blaine Higgs. Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Bonjour, merci Bruce. Good afternoon. Before I start with my remarks today, I just want to pay our respects to the women from the 1989 Montreal shootings at École Polytechnique de Montréal. So I just wanted to read those names of the people who lost their lives that day on today, December the 6th. Geneviève Bergeron, civil engineering student. Hélène Colgan, mechanical engineering student. Nathalie Croteau, mechanical engineering student. Barbara Dagneau, mechanical engineering student. Anne-Marie Edouard, chemical engineering student. Maud Havernick, materials engineering student. Maryse Lagagnère, budget clerk in the École Polytechnique's finance department. Maryse Leclerc, materials engineering student. Anne-Marie Lemay, mechanical engineering student. Sonia Pelletier, mechanical engineering student. Michel Richard, materials engineering student. Annie Saint-Arnaud, mechanical engineering student. Annie Turcotte, materials engineering student. Barbara Klusnik-Wijejewicz, nursing student. And I just want to note that on the sheet that I'm reading from, their dates of birth are listed there, and some of them are actually would have been very close to my age or slightly older at this time. So I just want to acknowledge that loss and of all their grieving families right now. Good afternoon, everyone. Bonjour à toutes et à tous. Aujourd'hui, je discuterai des questions suivantes: l'état de l'éclosion dans les zones 1, 2 et 3, une mise à jour au sujet du complexe Parkland St. John. Today, I will be speaking about zones 1, 2, and 3 outbreak status and Parkland St. John update. I wish to advise you that another round of testing of Parkland St. John residents and employees was recently completed, and a Tucker Hall resident has tested positive. The resident tested negative during previous testing rounds, but became symptomatic. It is our understanding that the resident has been moved to the cohorting area and contact tracing is occurring. Another round of testing for residents and employees of Tucker Hall will occur Tuesday. Therefore, to date, there are 17 confirmed cases at Parkland St. John, 6 employees, and 11 residents. Le 19 novembre, la zone 1, soit Moncton et le sud-est du Nouveau-Brunswick, est passée au niveau d'alerte orange selon le plan de rétablissement de la province en réponse de la COVID-19. Une semaine plus tard, des restrictions ont été mises en place pour la zone 3, soit Fredericton et le centre du Nouveau-Brunswick. Dans les deux zones, Santé publique avait constaté la propagation rapide des infections dans des milieux où il est difficile de contrôler et parmi les populations vulnérables. On November 19th, Zone 1, which is the Moncton and southeastern New Brunswick area, transitioned to the orange alert level after the province's under the COVID-19 recovery plan. 1 week later, these restrictions were put in place for Zone 3, which is Fredericton and the central New Brunswick area. In both areas, public health had seen a rapid spread of infections in hard-to-contain settings among vulnerable populations. We were also concerned by the low level of compliance with public health directives, as was provided to us by Department of Public Safety. Since then, there has been a marked improvement in the outlook for both zones. And on the basis of our assessment and balancing all the risks, public health supports the decision for Zone 1, the Moncton region, and Zone 3, the Fredericton region, to transition back to the yellow alert level of recovery tonight at midnight. Again, this was based on our risk assessments and balancing all those risks, and the declining caseload in both regions and high levels of public adherence to restrictions, which have been limiting the spread of COVID-19. We will be monitoring closely, however, and if we start to see more cases, we can go back to the orange phase at any time in any zone that is now yellow. So again, that was a cabinet decision that public health supports. Sur la base de notre évaluation, Santé publique a recommandé, a donné des recommandations au cabinet, et le cabinet a fait la décision dans les zones 1 et 3 de retourner au niveau d'alerte jaune de rétablissement. Cela fera à compter de minuit ce soir. La santé publique a formulé cette recommandation et support en basant sur les nombres de cas qui diminuent dans les deux régions ainsi que sur le niveau élevé de respect des restrictions visant à limiter la propagation de la COVID-19 par la population. Zone 2, however, which is the St. John, Kings, and Charlotte counties, will remain in the orange level of alert for the time being. We are seeing a vast improvement in the compliance in Zone 2, and I want to acknowledge everyone in all the zones for their hard work. You are doing an amazing job, and again, in Zone 2, I know everybody is doing their part. Thank you so much. Right now, though, in Zone 2, the number of active cases is still too high, and the risk of further transmission is too great to reduce the restriction in this area. And again, the ongoing outbreak in the Shanx also is influencing that. And while we were seeing new cases that are linked to other cases in that area, we have seen some cases where they weren't on our contact tracing list, meaning they weren't already at home self-isolating. So that's of concern as well. Public health will continue to monitor the progress in Zone 2 over the coming days, and once we see a decline in further risks, we will recommend the loosening of restrictions in this zone. While Zones 1 and 3 move back to the yellow alert level, I want to be very, very clear. The danger of further COVID-19 infections has not gone away. We have not reduced the risk to zero, nor can we. Je veux que cela soit très clair. Le risque d'autres infections par la COVID-19 n'est pas disparu. C'est pas disparu dans les zones 1 et les zones 3, c'est pas disparu dans la zone 2, c'est pas disparu n'importe où que vous demeurez dans la province du Nouveau-Brunswick. Nous n'avons pas ramené le risque à zéro et c'est pas possible de ramener le risque à zéro. Avec des transmissions communautaires à Nouvelle-Écosse, on voit des nouveaux cas à l'île du Prince-Édouard, on voit des cas dans Terre-Neuve et les cas qui sont dans les autres endroits du Canada. Yellow means caution. It is not an invitation to go full speed ahead into life as it was before COVID-19. So please take a look around us. Aujourd'hui, Québec a signalé plus de 2000 nouveaux cas en un jour, une première au pays depuis le début de la pandémie. Pandemic field hospitals are being set up in Alberta currently. They are talking about refrigerated trucks. Ontario is seeing daily increases in cases, hospitalizations, and deaths from COVID-19. I know there are hospitals in British Columbia where the physicians have not had a day off since August. The Premier of Manitoba has tearfully pleaded with his citizens to avoid holiday gatherings. And you've seen the same thing from the medical officer of health for the Ottawa City area. There are confirmed cases of community transmission in Nova Scotia and Prince Edward Island has new cases. They're still under investigation, but there is a concern there. Le virus est encore très actif. Il profitera donc de toute occasion que nous lui offrons. Aujourd'hui, il y a 4 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Dans la zone 2, il y a 2 nouveaux cas. Une personne âgée entre 60 et 69 ans. Une personne âgée de moins de 99 ans. Dans la zone 1, il y a un nouveau cas, soit une personne âgée de moins de 19 ans. Il y a aussi un nouveau cas aujourd'hui dans la zone 4, la région d'Edmundston, soit une personne âgée entre 60 et 69 ans. Pendant que les personnes se rétablissent, nous voyons le nombre de cas total baisser. Il y a maintenant 82 cas actifs au Nouveau-Brunswick avec 2 personnes hospitalisées, dont une aux soins intensifs, et j'aimerais que vous gardiez ces gens dans vos pensées. The virus is still very active, and it will take every opportunity that we give it. There are 4 new confirmed cases of COVID-19 in New Brunswick. In Zone 2, there are 2 new cases, 1 individual aged 60 to 69, 1 individual over the age of 90. In Zone 1, there is 1 new case and an individual under the age of 19. In Zone 4, which is the Edmundston region, there is also one new case today in an individual aged 60 to 69. As people recover, we are seeing the total number of cases decline. There are now 82 active cases in New Brunswick, with 2 individuals in hospital, one of whom requires an intensive care. And I ask that you please keep these people and their families in your thoughts and prayers. The other thing that, even though these zones are going into the yellow phase, it's really important to understand that there are still many, many people self-isolating in those zones, upwards of 300 people. So we know there can be more cases in those zones. I'm sure that some of you are wondering why we're lifting restrictions in zones where we are continuing to see new cases. It is because COVID-19 has not gone away, but the risk of transmitting and contracting the virus has been reduced in these areas from what it was a few weeks ago, but it's still not zero. Our review process primarily assesses the risks in terms of what are the chances that COVID-19 virus will be transmitted, where are those infections happening, are vulnerable populations like the elderly and those with chronic diseases being affected, and can our health system cope with the spike in the cases, not only in terms of how many cases of COVID-19 can we deal with at one time, but what is the effect on our healthcare workers, and what is the effect on having to postpone surgeries or cancer treatments, etc. Dans les zones 1 et 3, le risque que de telles choses surviennent à baser au cours des 2 dernières semaines, il n'est pas disparu complètement, mais il est moins élevé qu'il était. We are able to remove some restrictions today because of the efforts of the people in those communities who have helped us to limit the spread of COVID-19. You all have my deepest appreciation and heartfelt thanks. To the residents of Zone 2, I say this, please don't give up. You are doing a great job. You just have a bigger hill to climb. We are seeing progress, but the risk of transmission and the harm that could do to our most vulnerable citizens is still too great in Zone 2, and I ask that you continue to observe public health directions in Zone 2, but also anywhere where you are in the entire province. In particular, please take care to limit your contact with your people outside your one household bubble. Listen to your fellow citizens, such as the brave Zone 3 residents who went public with this fellow citizens, such as the brave Zone 3 resident who went public with her experience of catching COVID-19 in her own home, hoping that her first-hand experience would teach others how to be more cautious. And I actually spoke to her on the phone today to personally thank her for coming out with her story, because it was really touching and I guess inspiring to hear her experience and firsthand, and to understand what she went through in that process, and also to hear the great work that our public health staff have been doing in the regions. And she said that the person that she dealt with from public health was very, very compassionate, and that she had more anxiety while she was waiting for her test results than she did after receiving the test results, in terms of the reception within the community, and then also her interactions with public health. Your home may not be the safe haven from COVID-19 that you imagine it to be. If you are not cautious with friends and other visitors, remember to maintain physical distance with those outside your one household bubble. Limiting your close contacts is vital to slowing the spread of COVID-19, not just in Zone 2, but everywhere in the province. And I am going to sound like a broken record, and I don't really care if I sound like a broken record, because of the challenges we are all facing. Holiday gatherings and events with large numbers of people will drive the growth of new cases in the coming weeks, and nobody wants to see that. We have been able to avoid the disasters that we're seeing in other provinces and other jurisdictions right now, and we want to continue to keep it that way. If we want all of New Brunswick to be able to celebrate holidays safely and then have a safe New Year, keeping businesses open, protecting people's mental health, making sure that people still have incomes, and making sure that our schools stay open, and make sure that our healthcare system does not get overwhelmed. I really want to avoid having that happen, and so that is the reason why we all need to keep our numbers of close contacts extremely low. The orange alert level restrictions are a hardship for many, particularly for business owners, but it is worth it to save lives and protect the most vulnerable citizens and maintain our healthcare system. And again, those consequences that we're seeing in other provinces right now who are deeply into the second wave, again, both economic and health related, are so much more intense right now, and they're going to be longer lasting than our preventative measures have been to date. Il demeure extrêmement important que tous les gens du Nouveau-Brunswick, aux quatre coins de la province, prennent les mesures qui limiteront la propagation de la COVID-19. Portez un masque en public. Maintenez toujours une distance physique de 2 mètres des autres, tant à l'intérieur qu'à l'extérieur. Lavez-vous les mains régulièrement et souvent. Restez à la maison quand vous ne vous sentez pas bien. Ces mesures peuvent sauver des vies et en sauveront. It remains vitally important that all New Brunswickers in every corner of the province do the things that will limit the spread of COVID-19 that you have been doing up until now. Please continue to do these things. Wear a mask when you're out in public. Maintain 2 meters of physical distance from others at all times, whether you are indoors or out. Wash your hands regularly and frequently, and stay at home when you do not feel well. These actions can and will save lives. They will protect our hospital system. They will protect our livelihoods. They will protect our mental health. Please consider sticking to the plan that we've laid out thus far that has been serving us so well. Thank you very much. Merci.
Good afternoon. Bonjour à tout le monde. Today marks the 31st anniversary of the massacre of 14 women at the École Polytechnique in Montreal. It is important we all take a moment to not only just remember the lives lost that day, but to think of the women across this country and around the world who were impacted by violence. In recent days, we have seen increased compliance with public health directives in the province, enabling us to slow the spread of COVID-19. Nous sommes sérieux que les entreprises et la population prennent les mesures nécessaires pour assurer la santé et la sécurité de tout le monde. Thanks to this hard work and diligence, when the All-Party Cabinet Committee on COVID-19 and Cabinet met today, it was agreed that Zone 1, the Moncton region, and Zone 3, the Fredericton region, would return to the yellow alert level as of midnight tonight. Zone 2, however, the St. John region, will remain at the orange level for the time being, as there are still a number of active cases in this zone and the risk of transmission remains high. As Dr. Russell said, we will continue to monitor the progress in this region. Our hope is to return Zone 2 to the yellow phase alert as soon as possible, possibly later this week. Je sais que c'est frustrant pour la population de la zone 2 qui doit demeurer dans la phase orange. Ce n'est pas ce que nous voulons pour les gens de Brunswick, de la province, en particulier à l'approche du temps des fêtes. No matter where you are in the province, I urge all New Brunswickers to keep your contacts small as the risk is still with us and around us. We must continue to take precautions and be mindful and careful. Recent events have reminded us how quickly and easily our situation can change. While it is important that we celebrate the holiday season, we must do so differently this year. Take the extra precautions needed to keep your family and friends safe and healthy. Many of us are already looking ahead to 2021. And have high hopes for what the new year will bring, including a vaccine. Il est important de demeurer positif et d'être tourné vers l'avenir. Mais nous devrons aussi continuer à faire ce qui est nécessaire pour nous permettre d'atteindre cet objectif. Even at the yellow level, masks must be worn in public spaces and physical distancing must be maintained. Wearing masks and limiting the people we are in contact with is indeed making a difference. That is why we must continue to do both, even during the holiday season. En travaillant ensemble, nous pourrons assurer la santé et la sécurité de tout le monde. I am convinced that working together, we will get through this. And as we go through the holiday season, we indeed, just following the rules, will come out the other side ready for a vaccine to be administered early in the new year. Thank you. Merci.
Merci, Monsieur le Premier ministre. Thank you, Premier. Thank you, Dr. Russell. Merci beaucoup, Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have one question and a follow-up question. You have the right to pose your question in the language of your choice, and please ensure your microphones are muted today. Nous allons maintenant procéder aux questions de journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste peut poser une question et un suivi. Et s'il vous plaît, voulez-vous assurer de désactiver le son de vos micros. Sarah Plowman, CTV.
Good afternoon. There was about a few dozen people marching downtown Moncton this afternoon, not wearing masks and protesting masks. And I'd like to ask both of you what your message is for those individuals.
Well, I'll go first, then I'll let the Premier respond. Basically, the information that we have provided around masking and the mandatory order, et cetera, we support. We do understand there has been some confusion, and we will plan to come back with any of the confusing messages around any of the communications on different topics throughout the pandemic this coming Thursday to Cabinet. In the meantime, all of the information and evidence around masking is supported by Public Health Agency of Canada, is supported by our counterparts across the country, our Pandemic Task Force, COVID-19 Cabinet, and also our public health team. So all of the input to the evidence-based information, the research is all reviewed by many people that have input into our recommendations around masking. But certainly it is an evolving situation, and we will continue to evolve as we have new information. And so again, we will come back to Cabinet on this Thursday around clarifications and communications around that.
So when I hear of individuals that are in complete violation of our Emergency Measures Act and the rules and regulations that are set forth by public health, at a time when they're risking not only themselves, but certainly their friends and neighbors and wherever they may return back to get together, I find it extremely disappointing and irresponsible. I feel that, you know, we are all at this level right now in New Brunswick because people have generally followed the rules. We've seen a high degree of compliance. And when individuals blatantly flirt and flaunt the rules as if they're immune to all of that, that is, as I say, more than disappointing. And we will hope that they will decide to be part of the solution and not part of the problem. We have had to exercise enforcement over the past few weeks, but I'm pleased to say over the past week, we've seen such high levels of compliance. So everyone needs to encourage each other. Just do their part. Just be part of the success story, not part of the story that we just don't want to hear in New Brunswick.
Thank you, Premier. Thank you, Doctor. Ms. Plowman, do you have a follow-up question this afternoon?
Yes, I'd like to ask if we've seen in Nova Scotia asymptomatic testing, rapid testing sites pop up throughout the province, and other provinces are asking health officials here about how it's being done. Is New Brunswick considering doing something similar in the near future to have pop-up rapid testing sites available for people?
So far, when we've needed to have pop-up centers, we've done that. We've done mass testing in Zone 5 a couple of times now, and we will continue to do that type of testing when necessary. Up in Zone 5, there was the risk of community transmission. In Nova Scotia right now, there actually is community transmission, and so their level of risk tolerance and their ability to test and contact trace is challenged by the community transmission, and so I can see that the rationale behind why they're doing what they're doing. We don't have the same situation here. We certainly do use rapid tests in all situations that are necessary, for instance, in some of the outbreaks in long-term care facilities and adult residential facilities, when it's very important to identify and cohort and isolate people very, very quickly. We also have used it on occasion for other situations such as pre-op testing if there was something that was not able to be done sooner. But as of right now, we do have a testing strategy. We do have regular meetings with our lab folks around the new equipment and the new technology that's coming out and when and where and how it's appropriate to be used. So those details are still being worked out, so it's on our radar, but as of right now, we are content and happy with how things are going with our testing strategy thus far, and we will continue to incorporate the new types of technologies that are available as we see fit in terms of where they fit in and how they can be used appropriately.
Thank you, Doctor. Thank you, Ms. Plowman. Callum Smith, Global News.
Thanks, Bruce. My question is for Dr. Russell, and just to follow up on Sarah's question. So just to confirm, throughout all the testing and all the investigations, there has been no community transmission in New Brunswick?
We have, the majority of cases have not, the majority of cases are not community transmission. We've had a handful of cases that were identified as community transmission. So, and that is on our dashboard. So if you want the exact total number of cases that we identified as being community transmission, it is on our website.
Callum,
Thank you for that.
do you have follow-up, Callum?
Yes, I do. Thank you. Again, I guess probably for Dr. Russell, I don't know if Premier Higgs wants to weigh in, but obviously we've talked a lot about the holidays so far. How concerned are you that in January or thereabouts that we'll see another surge in cases? I understand you're saying to everyone to follow the rules, but how concerned are you that we'll have a worse situation in January or February?
I would like to say that I'm not concerned, but I actually am very concerned. There is never going to be a time in this pandemic when the risks will not be will be zero, and the problem right now is the holiday season is a time when people tend to travel and they tend to gather in close proximity in large numbers. The risks of importing cases of COVID-19 into the province are high right now because of the transmission happening in all the other provinces in Canada and also what's happening in the US and globally. So this is not the time to travel. The risks are higher than they have ever been throughout the entire pandemic, number one. Number two, because our next door neighbor has community transmission, and we know that community transmission can pop up anytime, anywhere, I am concerned that any of these holiday gatherings can contribute to another super spreader event at any time in any part of the province. So I am very, very concerned, and that's why I want the message to be people need to stay put. They need to not gather, and they need to keep their bubbles and close contacts extremely low, or we will see more outbreaks and we will see more super spreader events in the new year.
Thank you, Doctor. Thank you, Mr. Smith. Tom Bateman, Times and Transcript.
Oh, good afternoon. First for Premier Higgs, and again on this anti-mask rally we see in Moncton, where there are groups of people, as you said, flaunting the rules, we could do more than just hope that they follow the rules. We could enforce them. Why aren't police officers or enforcement officers being more active when these sorts of protests happen?
So certainly, we've been very active in the enforcement category over the last 3 weeks, and that'll continue. And here's the balancing act that we're in. And if parades start together and we start to see this sort of outburst in the community, it's quite hard to imagine the reality of why that would be, why anyone would take part in that, and why this isn't. This is not a case where this is not under control. That's why we wanted to get back to yellow as quickly as we can to give more freedom, so people are able to follow the rules but have a little more social life. But if we have to bring enforcement into play in this, we will do that. But what we have seen across the country is that, if people are bent on breaking the rules or just trying to, as I said, flaunt the rules, they will endanger themselves and others, and they're doing it willingly and irresponsibly, and it's a hard thing to enforce across the province. However, if everyone is reminding each other that, look, we just need to be diligent here for the next several months or many months until we get the vaccine, but we know it's right around the corner, let's just not turn this into a situation where it's only a police enforcement that causes people to do the right thing. It's actually their own conscience that causes them to do the right thing. And we know that this last few weeks was created by a couple situations where caution was thrown to the wind. And then every community, every business has worn it and paid the price. And every other individual has paid the price. And so that is the issue, is that there's more to it than just arresting someone or giving them a ticket. It's saying, look, this is a case where you're helping your neighbors, and it's not too much to ask to simply wear a mask.
Thank you, Premier. Mr. Bateman, do you have a follow-up?
Yeah, I do. Thanks for that. Again, for Mr. Higgs, or Premier Higgs, on the vaccine, could we have some more details about this dry run we're hearing about from Ottawa of the vaccine rollout? What will that look like in New Brunswick? Is our supply chain ready to go? And what will we see this week?
Well, this may be a tag team response as well, but in our discussions and in my discussions thus far with the Prime Minister and colleagues across the country, and certainly getting ready for rollout of the vaccine, we know a few things. One is, in New Brunswick, Greg McCollum, our director of the Emergency Measures Organization, is our point person with the military in relation to how logistics will work. Secondly, we're aware of limited doses that will be available in December, but very limited, not really to a point where anyone is going to have any great vaccine rollout, but basically just the logistics of being able to manage, and I would say most particularly the Pfizer vaccine that requires the minus 75 degrees for storage. So that is all that'll be learned through December, and the rollout that we are planning for is actually what will take place in the first quarter of this year, where we've been told directly that, we should have about 60,000 units that we will be able to set up and actually vaccine in a looking at a priority basis. And we'll work with public health on what the priorities should look like. But the important part of all of that is what will be the schedule of delivery. Do we get the 60,000 vaccines all at once? Are they spread out over the first quarter? What's the timing going to look like? So for me, it's I need the timing of delivery so we can plan the logistics. And we feel very confident, whether we are working with the military or using our own resources that have delivered vaccines, forever in our province. We feel confident we can manage the logistics of it all. But we're pleased with the backup resources that the federal government and the military have offered.
Dr. Russell?
Hi, Tom. Yeah, I'll just add to what Mr. Premier Higgs is saying. So it is a dry run for us to ensure that all the measures are in place logistically. We do have Greg McCollum now is in charge of the logistics for the vaccine rollout, which is great. He has a military background. I actually have worked with him before in the military, and obviously he has a long history here in New Brunswick of leading us through many emergencies, whether it be a flood or other situations like that. So we have everything in place that we need from a planning perspective. It's a matter of then operationalizing it and make sure that that what's on paper is actually smoothly rolled out in reality.
Thank you, Doctor. Thank you, Premier. Thank you, Mr. Bateman. Vicki Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, do you know at this point how many freezers New Brunswick is planning to get to store the vaccine, and what locations you're considering for these freezers, and if New Brunswickers will have to travel to these locations to be vaccinated?
Hi there. As of right now, we do have some preliminary plans in place, but I don't think we're at the point where we want to share them publicly. There are many, many security issues around the logistics pieces. We have heard internationally of some challenges with hackers in terms of the transport of the cold chain and protection of the cold chain of the vaccines, but I will turn it over to the Premier to add anything to that.
I don't think there's much I can add to that. I believe the federal government acquired 26 actual freezers. I think that this trial run is, to me, it seems like a lot more related to Pfizer's product and the concern of how it's going to be handled and managed, because it is unique to the other vaccines in that regard. There are 7 vaccines to get all together. The federal government has assured us they have certainly acquired multiple doses, millions of doses of at least with 4 different suppliers. So I don't think that vaccine supply will be a problem. I think initially, it's kind of figuring out the timelines and the priorities. But I think this dry run is basically Pfizer wants to ensure the public and the government that they can actually be able to manage the distribution of their product, because and they're directly involved with it, which is I'm not sure if the others are in that sense, because it requires specific handling.
Thank you, Premier. Thank you, Doctor. Ms. Hogarth, do you have a follow-up?
I do. Thank you, Bruce. It's for Dr. Russell. Dr. Russell, how many active cases would you like to see Zone 2 get to before it's eligible for reassessment to return to yellow?
It's not about the active cases. We have 3 categories of triggers for our risk assessment, and we will be doing another risk assessment on probably Tuesday of this week. So the 3 categories involve hospital capacity, but that also includes healthcare workers and how many are impacted at this point in time. So that, again, we are seeing improvements there, but we're not completely where we would like to be. Contact tracing, we're up to speed with our testing, so that's going well. We're seeing public health, public compliance to public health measures increase. That's going in the right direction. But the fact that we still see an outbreak in a vulnerable setting, that's still concerning. And the fact that some of the cases, while they are linked, were not on our contact tracing list, and therefore they were not self-isolating at the time of their diagnosis. So the contact tracing for those people has to be done, and there could be more people affected in that way. So we haven't turned the corner quite yet, but it's not a hard and fast number in terms of the number of cases. We look at doubling times. We look at the type of transmission and the settings that the transmission is taking place in.
Thank you, Ms. Hogarth. Thank you, Dr. Alexander Silberman, CBC.
Thank you, Bruce. Premier Higgs, what are your plans in terms of possibly reinstating the Atlantic bubble, and how likely is it that the bubble will reopen in time for the holidays?
So I guess it'll depend, obviously, in relation to where we are in all our zones getting back to yellow, and the same thing with what's happening in Nova Scotia, and Dr. Russell referenced the community spread concerns. I think at this point, us getting back in yellow at this time is important. Seeing students come back, if they're coming back home for Christmas and having that isolation period is important. And we need to get that kind of working well before we can simply go back to the bubble. I believe PEI have said December 21st or something like that. They've said they reconsider. I'll be speaking with our colleagues. I'm sure Dr. Russell and their team will be speaking with their counterparts in each of the Atlantic provinces, and collectively we'll decide if it's even feasible or not. But I'm thinking that this is the last, I say the big significant event that's happening between us and a vaccine. And so we cannot lose sight of, we need to get through this hurdle, as difficult as it is. We can't lose sight of getting through this safely and not having an outbreak, because the vaccine is coming in the new year. So we'll have to be very cognizant and aware of that in ensuring we don't open up in a way that would increase the chances of an unexpected outbreak.
Thank you, Premier. Mr. Silberman, do you have a follow-up?
I do. Dr. Russell, it hasn't been 2 full weeks for Zone 3 in the orange phase. Why are you moving that zone back to yellow now?
Well, that is a COVID decision that we support. We provided lots of evidence around what the risks are, and that's our job. So we qualify the risks, we quantify the risks, we frame the risks in terms of what are the most concerning things about any zone at any time. And I think in the context of the fact that We are trending in the right direction. Again, there's not zero risk. So, we do know the incubation period is 14 days, and that's why we've always recommended 14 days for any measures to be in place, because that's really the full amount of time that it takes to see if the measures are working. We do have evidence that the public health measures, that the public is complying with public health measures. We are not seeing continued transmission in areas that we were hoping not to see transmission. However, I think we still have challenges with respect to people getting infected within their homes. Again, highlighting the woman in the Centreville area who talked about her experience. That will continue to be a risk throughout the province, that people will still be at risk in high traffic, high volume settings like bars, et cetera, but they're also going to continue to be at risk in their homes because of people coming and going without masks, et cetera. So, and the caveat being that if we see a spike in cases again, because we do expect to see more cases in Zone 3, because there are 300 people self-isolating in this zone right now, that we could see some more transmission, we could see some more cases. We're hoping not to. But again, those risks are all presented to Cabinet.
Thank you, Doctor. Thank you, Mr. Silberman. Natalie Sturgeon, Telegraph-Journal.
Thank you, Bruce. My question is for Dr. Russell. Early on, you said that you were hopeful that you could contain the outbreak in Zone 2 under the orange phase. That has not happened, and you're continuing to be concerned about the situation in Zone 2. What discussions have you been having about the red phase to bring this outbreak under control in the St. John region?
Well, our risk assessments haven't been around going to red. They've been around coming back to yellow. And we are looking at things like the positivity rates, the cases per 100,000, the number of tests we're conducting. And right now in Zone 2, we are still seeing, again, the vulnerable population setting being a factor. And so we're still looking at that. And so what we really want to see right now is we'd like the Shanix, the ongoing transmission at the Shanix to not be there anymore. And we would like to, we have seen significant improvement as per public safety in terms of compliance with public health measures. We are looking at the doubling time as well. I think we were a few cases away from seeing that the number of cases double in that zone. So that was the other reason that we were a bit reluctant to move to yellow. And we did have a backlog of tests that did have an impact. It has improved now. But again, I think we could possibly still see effects from that. So again, when the last couple of cases that we have seen in the Zone 2, again, they weren't on our contact tracing list. They were people that are connected to the outbreaks. They do have links, but they now have close contacts that have to be traced, et cetera, and isolate. So again, we're just keeping an eye on that. And again, our next risk assessment is going to be on Tuesday. So we probably will have more information to present to Cabinet sooner rather than later, and we'll keep you posted.
Thank you, Doctor. Ms. Sturgeon, do you have a follow-up?
Yes, this follow-up is for Premier Higgs. Is the province considering stronger enforcement of isolation requirements for travelers to ensure that the current zones that are in yellow, or even Zone 2 when it does go to yellow, will stay yellow in the winter?
Well, actually, I think that the tracking of travelers has been good, and I think the changes that were made back a month or so ago in relation to ensuring that the testing was done, the incremental testing for people that are traveling and coming back home, that is well in hand as well. So I think we certainly will continue that and monitor and call and connect to make sure that the testing is done and the isolation procedures are being followed. So we will continue to, if we want to call it enforcement or monitor, we'll enforce it if we need to, but we certainly will be tracking it as we have been, and thus far that has been successful to do that.
Thank you, Premier. Thank you, Ms. Sturgeon. Jordan Gill, CBC.
Yes, this question's for Dr. Russell. Yesterday, a person was listed as being in the ICU because of COVID. Are there any more details you can give about that case, their age, location, condition, anything like that?
I'm sorry, I can't provide any more information at this time, but if there is any more information that I find out, I can relay that.
Thank Thank you, Doctor. Mr. Gill, do you have a follow-up?
Yes. Considering it's still about 3 weeks until Christmas, was there any concern that loosening restrictions now may lead to more case increases, which would put the areas 1 and 3 back into orange just right about at Christmas time? I guess why not wait a little bit longer?
I hear what you're saying, and honestly, the risk is never going to be zero anywhere in this province. And I am concerned. I'm concerned every single day about community transmission, about super spreader events, about people gathering in their homes, about people gathering in high-risk, high-volume areas. So I think we're trying to balance all those risks. And again, we can put numbers on those risks in terms of percentages and probabilities. But there are always unknowns. For instance, when we talk about contact tracing, there have been times where, we can do everything right. And I am just echoing something that a colleague had said, that we can do everything right and still have things go sideways. So I think we have to give people the benefit of the doubt in terms of trying to do the right thing and follow public health advice. We are seeing quite a bit more compliance right now. So that is encouraging. We do want to keep people's spirits and morale up, and we also want them to be aware of the very, very, very serious risks that exist. But again, it's trying to balance all those things. And when you look at how New Brunswick is doing compared to the rest of the country right now, again, we are in a very good place. And so the frustrations and annoyances and the ongoing challenges of dealing with COVID-19, whether we're in an outbreak situation or not, it's going to be with us, and we do have to continue to live with it until the majority of New Brunswickers can be vaccinated. So yes, I'm very concerned about outbreaks prior to Christmas and the holiday season. I'm also very, very concerned about outbreaks after the holidays, 14 days after the holidays to be specific. So I just encourage everyone to take everything that we're saying really, really to heart and to do their part.
Thank you, Doctor. Thank you, Mr. Gill. Michael McDonald, Canadian Press. Rose Saint-Pierre, Radio-Canada.
Merci, Bruce. Ma question est pour Jennifer Russell. Au sujet de la région du Grand Edmundston, on a rapporté un cas aujourd'hui dans la zone 4. Ça fait 7 cas actifs depuis la semaine dernière, si mon compte est bon. Est-ce qu'on est inquiet de transmission communautaire?
Tous les cas à ce moment-ci sont tous liés sont tous un contact étroit de quelqu'un qui est lié un cas qui est lié au voyage. Alors non.
Donc, pas de crainte qu'on passe en phase orange, par exemple, dans la zone 4.
Non, pas à ce moment-ci, mais on ne sait jamais, les risques sont toujours là.
Mademoiselle Saint-Pierre, as-tu suivi cet après-midi?
Oui, je vous ai entendu en anglais, Madame Russell, sur ce qui explique les raisons pour lesquelles la zone 1 est en phase jaune, même si on a des cas aujourd'hui. Est-ce que c'est possible de répéter en français, s'il vous plaît?
Je croyais que j'avais discuté, je croyais que je parlais de zone 2, mais toi, tu avais des questions sur la zone 1?
Oui, c'est ça. Pourquoi la zone 1 est en phase jaune, même si on a un nouveau cas?
C'est parce que c'est pas les nombres exacts de cas. D'habitude, c'est le type de transmission qu'on voit. Alors, il n'y a pas de cas maintenant dans des situations avec des populations vulnérables. Et on ne voit pas de transmission communautaire à ce moment-ci. Et les gens sont vraiment ont coopéré, sont ajustés aux directives de santé publique et il n'y a pas d'impact négatif sur les services de soins de santé à ce moment-ci.
Merci, Mademoiselle Saint-Pierre. David Caron, à Crédit Nouvelle. David Caron, l'Acadie Nouvelle. Merci tout le monde. Cela conclut la séance d'aujourd'hui. Merci beaucoup. Thank you, everyone. That concludes today's update.